since the early days of January 2020. I'm based at the Toronto Globe and Mail, but some of you may know I'm also from the Soo, and am proud to call the Soo my hometown. Haven't been able to visit in a really long time, but hoping maybe the doctors can shed some light on this tonight, that if things keep going the way they're going, we can all get together with family sometime this summer. So this is a really important and exciting event, and I think there's a lot of interest in this from the community, because there is just a lot of discussion and anticipation about vaccines for people who are age 12 to 17, and also people that are younger, and we'll be getting to that as well. So before we go further, I just wanted to introduce who the experts are tonight that are going to be on this panel. And then we're going to get into some of the questions. Some people in the community had an opportunity to submit their pressing questions, and we've looked at those, condensed some of them that were similar in nature, and we're going to try and get to as many of these topics as possible. And we should also note that this live stream will be available on the Algoma Public Health website, and perhaps elsewhere after this event as well. So I would like to welcome tonight Dr. Jennifer Liu, a name that pretty much everyone in the Soo is familiar with now, a public health and preventive medicine specialist and the acting medical officer of health for Algoma Public Health. Dr. Lucas Castellani, again, another household name these days, an infectious disease specialist doctor at Soo Area Hospital. And we also have with us the Soo's own Dr. Jonathan DellaVedova, pediatrician at the Group Health Center. So thanks everyone for being here tonight. And we're going to kick things off with Dr. Castellani giving us a short presentation on where things are at. So I will turn it over to you, Dr. Castellani. Take it away.
Perfect. Thank you. Thanks for helping us out with this today, Carly. I'm going to switch over to my PowerPoint. And hopefully this will work. Here we go. All right. So I think, the important thing is to talk a little bit about, the vaccine background and information before we sort of get into the nitty-gritty of the questions, just so everyone has a frame of reference. I'll try and zip through this piece as fast as I can, as I'm sure we're inundated with a lot of information over the past while, but certainly if there's any topics that need to be discussed further, I'm happy to do so. I'm sure my colleagues would be more than happy to do so, and we'll hopefully get there during the presentation. So as Carly said, I'm an infection doc here in the Soo, and I work at the Soo Area Hospital. So my conflict of interest really is that I'm part of a group called Community Pass, or that works on an app called Community Pass. That's an all-in-one COVID app. So I just thought I'd put that out there ahead of time. So today, just briefly, before we go into the question and answer, we'll talk a bit about COVID, what makes it scary, why the vaccines are helpful, and then we'll go through a few of the common questions, and then we'll get to the sort of more detailed questions after. So COVID-19, this is a busy slide. The main reason to put this out there is to say there's a spectrum of illness. So you're all probably familiar, have heard, of someone having no symptoms at all to someone who's ended up in the hospital quite unwell. And this goes the same for children. In fact, predominantly kids and young adults have minimal symptoms. Certainly that's in the literature and in my experience seeing these folks. Usually it's like early on in the illness, you may get a cold or flu-like symptoms or nothing really at all, but a couple weeks in you might sort of be more unwell, and that's the period of concern that ends people into the hospital, unfortunately. We're all familiar with quite scary pictures like this of someone ending up in the intensive care unit requiring a breathing tube and help breathing. This is less of a concern, fortunately, for young adults and children, but it certainly is still a concern. And it's important to remember that influenza are sort of common seasonal virus leads to severe illness in children, but fortunately we haven't seen the same numbers for COVID, but that's because of all the mitigation, all those efforts that public health has done, because certainly if we didn't have those efforts, I suspect we'd see as many problems in children or maybe more based on the numbers that I've seen out of the US. But actually scarier for me as a young adult personally and having young kids and family is this. This is a graphic representation of something people have probably heard of called long COVID or post-acute COVID syndrome or long hauler syndrome. These are this is a sort of a group of symptoms that can be anything from brain fog or trouble functioning day to day to pain to trouble breathing, and these all are triggered by the virus itself. And certainly I've seen my fair share of folks that are young and have had this after the virus. But probably most pressing on everyone's mind is this. We've all seen through the pandemic empty classrooms, empty schools. We've seen graduations virtually. We haven't been able to go to activities we've normally been able to do. Life is definitely not normal. There's lots of issues with mental illness, and there's lots of issues with illnesses in general. Coming in late to the hospital and being neglected because of all the restrictions and things that are in place. But there is a way out, and that's why we're here today. It's vaccines. And there is a way where we can get back to school. There is a way that we can get back to traveling, which is something that's near and dear to my heart. And there is a way that we can get back to hanging out with family and not worrying about risking our grandparents' health or our parents' health or things like that. There is a way forward, and like I said, it's vaccines. So this is just a graphic representation of the types of COVID vaccines that are out there and available, or at least that have been researched and are still sort of being researched. We're going to talk a little bit about one of the types of vaccines, which is a nucleic acid vaccine, the mRNA vaccine, because that's currently what we're giving out in Canada for kids and young adults 12 to 17, which is why we're here today. So these are the vaccines that are currently available in Canada. I'm going to focus you on the first two, which is the Pfizer vaccine and the Moderna vaccine. The last two are AstraZeneca and Johnson & Johnson. Those are sort of, in some sense, for younger individuals falling out of favor owing to some potential risk and side effects of thrombosis or clots. But we still have to stay tuned to how that's going to evolve fully. But for today, we're going to talk mostly about the first two. These are mRNA vaccine, and I'm going to show you a quick video in a second. These are vaccines that haven't really been seen used in humans as of yet until this pandemic, but it's decades worth of research and use in other settings that has led us here today. These types of vaccines are very effective and actually very good at to reproduce quickly for a pandemic. So that's partially why they were chosen. The other piece about them, about these vaccines that I should point out, is they studied them in thousands of people. When in medicine we look at vaccines or any medication, we want to see how many people did they study it in, and this is up there with some of the biggest studies we even have available for all medicines. And in kids, in young adults and children, age 12 to 17. The studies were in thousands of individuals, which my colleague, Dr. DellaVedova, could probably concur that that's a big study when you're talking kids. So we're pretty fortunate to have this data and information that points to the safety and information, and then I'll get to some information about how we monitor these things moving forward. But before we do that, I'm going to press play on this. I hope it works. No, of course it's not. My video, it doesn't want to work for me today. So just hang tight. And no, it's not. Oh, here we go. So I hope that gave you a bit of a background, although complicated in a minute, about the COVID-19 vaccine. And to point out, we are currently going to be using the Pfizer vaccine here in Ontario as of right now, although preliminary data suggests the Moderna vaccine will also be efficacious in young adults and children. But why can we have a confidence in these vaccines? I must point out that when the world stopped, science didn't stop, and scientists, physicians, administrators did not stop. They were trying to find a way out of this pandemic, and all efforts went towards COVID-19, and a good chunk of that effort went towards vaccination. So if you can take all of the scientists in the world, or at least a good large number of them, and you put them all working towards one thing, which is a vaccine, then you take a lot of people that have the virus. That means a lot of people to study, which we've never really had before. You can quickly come to figure out whether or not those vaccines will work or not. And then secondly, once those vaccines are discovered, you want to prove to the administration, to the world, that they're actually safe and they'll work. And all the people that are in the roles that do that are now supported by many other people who were working in other jobs, and being able to rigorously look at the data and say, are these things effective and are they safe? And what they've come to the conclusion is, yes, they are. And I think it's safe to say that they've rigorously looked at it, and we can be confident in it. The final piece that's very important is that after a drug or any medicine is discovered, once it's marketed, once it's put out there in the world and being used, you want to watch and make sure that nothing's happening. You want to make sure that there's no side effects or things we didn't expect. And since the time it's been put out there in December, we've seen no real significant concerning issues, other than with the AstraZeneca vaccine. We were worried about the clots, and that was recognized quickly because people were watching. And I'm going to talk a little bit about something called myocarditis in a second, but that was recognized quickly because many people are looking at it. So I want you to be rest assured that there's a lot of supporting folks trying to prevent us from using these things unwisely. So how long will the vaccines work for? Unfortunately, there's no long-term data. We think at least 6 months based on some data, but I suspect it's going to be longer than that. We know natural immunity. That means if you've gotten the infection, your immune system will work for at least somewhere around 8 months. We suspect vaccines should be about that, if not longer. What are the side effects of the vaccine? As the video said, they're pretty common to have side effects. Those side effects are having a headache, feeling a bit feverish, feeling a bit achy, maybe being a bit run down for a day or two after, having a sore arm, sometimes some lymph nodes in your armpit or on your neck. Those are common reactions, and unfortunately, they actually go away with it, within a day or so. The fortunate thing, though, is serious side effects are rare, and we haven't seen too much of them in the course of this pandemic, which is great. The myocarditis piece is an inflammation of the heart muscle. This is what I was mentioning before. They've noticed this lately because of the close and rigorous watching of people after they've been vaccinated. And what they've learned is that there are people who have gotten the vaccine, and afterwards it looks as though they've gotten this inflammation of the heart muscle. It seems mostly young men in about the age of 16 to 30. But what we're realizing is we still don't know if that was triggered by the vaccine, or whether or not that is normal, or that's an expected number of episodes of this type of illness despite the vaccine itself, because we know even viruses such as COVID-19 can cause myocarditis or inflammation of the heart muscle. So we still have to watch this closely, and it seems mostly to be happening after the second vaccine or the second shot of Pfizer. So it's important to note that, because we can feel more rest assured going forward with the first vaccine, because we have time to learn more about this. So should I avoid the vaccine if I have allergies? There were severe allergies noted early on, or a thought that there'd be a concern if you had severe allergies. But what they learned was that unless you have allergies to specific components of the vaccine, you can reasonably and safely receive the vaccine. And they've done a very large study with, all the people who got the vaccine between December and January, which is over 1 million people. And they really only had somewhere in the range of 1 in 1 million reactions in the United States secondary to the mRNA vaccine. So that can be that's very reassuring, and actually, around the number that you would expect for any medication that's come out. What do we know about the long-term side effects? We still are studying, but most vaccines, you don't really expect to have long-term side effects. Almost every vaccine that's ever been put out there and been used, we've studied even when people have thought that there were long-term side effects. We've looked back, and what we've learned is that they weren't actually related to each other. And so we can be rest assured that most likely when we follow this in the long term, we won't see any concerning side effects. Will the vaccine affect my future fertility? I don't think so. What was concerning early on was there was maybe some mimicry, meaning a molecule in the placenta looked similar to something in the coronavirus that was being used in the vaccine. But in truth, what they found is it's not really that closely related. And many people have gotten the vaccine and have since gotten pregnant and had babies and been great. There's been a concern about men having potential loss to fertility. Again, like any fever-causing thing, such as the vaccine or an infection, that can reduce fertility in men. But really, this is short-lived, and I think it's not a specific thing to the vaccine or really anything to worry about. Immunocompromised individuals, I would strongly recommend getting the vaccine. You can speak with your provider, with your doctor, with your nurse to understand what to do moving, into getting the vaccine. Because some people would recommend some changes or things, but really there's not much more to recommend other than get your vaccine, or if you're not sure, talk to your provider. How do I treat the side effects of the vaccine? Make sure you get pre-medicated. Make sure you do not get pre-medicated, I should say. The important thing is knowing you will probably get a side effect, or there's a high chance you will get a little bit of feeling, not too great after the vaccine. Some people feel fine, other people don't. But the key here is if you pre-medicate, you may reduce your immune response. So what we want to recommend is if you need it afterwards, you can consider things like Tylenol or Advil for symptom relief. And finally, will the vaccine work against these new variant strains? We hear about this day in and day out, a super mutation or the scary virus coming out of this country or that. In truth, the vaccine works. If we can be confident in one thing, it works. And in places where we're seeing these new strains arise, what we're seeing is people who've been vaccinated do very well. And so if I can recommend one thing today, it's vaccination. Because if we want to get back to our families, our friends, to travel, to some normalcy, we have to consider vaccination. And so I'll leave you with this. My wife got me this nice hat, which I'm wearing today, that says I'm vaccinated. I'm proud of it. If you need to contact me with any questions or anything, you can direct message me on Twitter, or you can send me an email, whatever you'd prefer, and I'd be more than happy to answer. So thank you.
Thank you so much, Dr. Castellani. That's just not only answers a bunch of the questions that I had, but I'm sure everyone else, and also ends on a nice message of hope. We certainly do all want to get back to normal. So, and the vaccine numbers are looking really promising. But we do turn, our attention to the people that are under the age of 18 because, they're still sort of relatively new to being vaccinated in Canada. I'll throw this out to the group, but perhaps Dr. Castellani, you can just start us off and just briefly touch on this idea. And this is something that I get asked about a lot, that a lot of people have questions about, which is, we hear that COVID-19 continues to be relatively mild in teens, in children. Why is it so vital that they be vaccinated? Why do we kind of have to wait to, quote, get back to normal until that point when we have the youngest cohort vaccinated? Like, why is that so vital? So if you can just touch on that, and then Dr. Liu and Dr. DellaVedova.
Yeah, I mean, it's an important question, and I think it's there's a multiple pieces to this. So one, remembering that children and young adults with COVID-19 is not something to turn away from. It can't, even though the numbers are small, it can cause serious problems. And there we've seen things like multi-system inflammatory syndrome, which is a very, inflammatory severe illness that we don't know the consequences once you recover from it. We've seen long COVID in young adults and children. So certainly from a medical point of view, there is benefit to vaccinating this younger population, even though proportionally, you're right, that less of them get these severe concerning things. But I think more important is the getting back to normalcy, because remember that we all have the potential of spreading the virus. We all have the potential of sharing this virus with those we love. And when that happens, there's such catastrophe that can arise, such as, severe illness and death and problems to our loved ones and our family members, that in my mind is one of the biggest reasons is we're helping our families, we're helping our friends. And the faster we can get our numbers down and get everything back to normal, even though we appreciate that young people don't have as many of the severe illnesses, the faster we can get the numbers down, the faster we can rest assured that all of our population is safe and we can move forward. The final point is the moving forward, and I think that's important. We don't know what it's going to come about this in the world. We don't know if to travel, if you need some sort of vaccination passport. We don't know if to do activities or go to school, if you need a vaccination passport. We suspect probably there will be some elements of that in our communities to be able to get to normalcy. So we really want to encourage that so that people, have a way out, if you will, so we can get back to that normalcy.
Definitely. Dr. Liu, what would you say?
I think Dr. Castellani hit it right on the head. And I would also say that we're still in the middle of the marathon of providing immunization to our entire population. Here in Algoma, we've immunized just over 50% of our entire population with at least one dose. That's fantastic. It means 1 out of 2 of us have gotten at least 1 shot. And also it means that they need their second shot, and we've still got half of the population to go. And for the time being, while the majority of folks are not completely immunized, there are consequences to getting COVID-19 beyond just the health consequences, right? Isolation for 10 days if you're sick, or if it's someone in your household for 14 days, that's pretty tough. It means you have to stay home. It means you can't touch anybody, you can't see anybody. And that's a very long time to be in that isolation. And especially if, you're a person who needs care or you're taking care of someone else, that's really tough on a family. So, for the time being, there's really good protection that's being offered with 1 dose of the vaccine and eventually 2 doses of the vaccine. That's the maximal protection that you'll be able to have. As we continue to get more and more of the population vaccinated, it means that eventually you're not going to have that risk of catching the virus or have someone in your household catch the virus. And that isolation and quarantine piece is not going to affect your lives, because it really has a great impact.
Dr. DellaVedova, as a pediatrician, what would be your perspective or take on that?
Yes, Carly, you've asked the same question that is the most common one that I get from parents in the past couple of weeks as vaccines have become available for younger kids. We've spent quite a bit of time in the past year reassuring kids and teens that they're less likely to get very sick from COVID, and that remains true. So I have a lot of parents asking me, well, what is the point then of getting kids vaccinated? But it's really important to remember that kids can and do get very sick from COVID itself. They can also have long haul symptoms, as Dr. Castellani outlined. But most importantly to me, kids suffer greatly from lack of access to school, lack of access to recreational opportunities, social activities, mental health supports, other supports. I've spent less time at the hospital this past year, but much more time in my office seeing patients for mental health issues, anxiety, depression, eating disorders, a shocking number of overdoses among kids. So kids are the group that are going to benefit the most from getting things back to normal. So it's really important that we all participate in vaccines.
That's a great way of putting it. Yeah, they've sacrificed so much, and I'm sure that so many people listening are still trying to deal with the fact that school is not going to be back in session until September. Before we go further, I wanted to invite one of the community members to ask a question. We have a parent named Anita. She's actually taking time out from a birthday party right now with her family to do this. So thanks, Anita, for being here, and please go ahead with your question.
Well, we're really lucky in my family. There's 5 of us, but 4 of us have gotten our first dose. The birthday boy, who turns 10 today, obviously has not received that dose. So my question is, what about our youth? What about the kids under 12? Are they going to get enough herd immunity? Or do I need to do something to keep them safe? Is there extra precautions that we need to take to keep those kids safe until that time when they are vaccinated?
Sure, so I can attempt to answer your question for you, and thank you, Anita. So for the under 12 age group, we're just not quite there yet. It's very typical for new medications and vaccines to be established in adults before working their way down to kids. Kids are more difficult to study, more difficult to consent, as you would imagine, and they have more to lose. So that sequence from older to younger looks pretty normal to a pediatrician. However, even as we speak, the leading vaccine manufacturers are studying safety and efficacy in the pediatric age group. We are expecting similarly good results. So if and when the vaccine is approved for children, it would be very important that they do get vaccinated. And in the unexpected event that young children are not eligible to be vaccinated, it would be even more important for everyone else to get the vaccine. So the short answer is nobody really knows the answer to the herd immunity question for sure. With the more highly contagious variants out there, it looks like about 75% of the population needs to be vaccinated to stop the virus from circulating altogether. And as you can imagine, it would be very difficult to get to the 75% if the 12 and under group is not participating. In the meantime, it's still very important for kids and teens and their family members to keep following public health guidelines surrounding masks and distancing like you have been doing up until this point. And we're hoping and keeping our eyes out for really good news in the near future.
That's great. Anita, thank you so much for being here and for adding to the conversation. And yeah, thank Dr. DellaVedova for that perspective. And, you know, we have about 30 minutes left, so I'll try and get through as many of these questions as we can. And we also have some more members of the community that will be participating as well. One of the questions, and I'll sort of maybe double barrel this, and I'll put this out. Perhaps Dr. Liu can take this on, and then whoever else wants to jump in. So we're still obviously working on first doses for a lot of the community, but you know, now that this school year is over, in person at least, a lot of people are looking ahead to what September might look like. So a couple of items. Will mandatory vaccination ever be on the table when it comes to COVID-19 and school-age students? Because you know, we do have precedent already for you know, vaccination requirements for things like measles in school. And what about second doses for students, staff, and their families as well? So basically, yeah, when can we see the school population get fully vaccinated, and will they need to be for things to really go back to normal school-wise? So Dr. Liu, what's your perspective there?
For sure. So in terms of when second doses are going to happen for students and that school community, the reason why the province is prioritizing the youth 12 to 17 for June is that the timing is so they can get their first dose in June and their second dose 2 weeks before the start of school. So they can, again, benefit from that maximum protection before school starts. So that's why we're saying, you know, please don't wait, pre-register. That way you can get your first dose now and your second dose before the start of the school year. With regards to whether or not it will be mandatory, I think these are really active discussions that are happening right now at the provincial level. We've already seen that the Ministry of Long-Term Care has said that all our long-term care homes have to have an immunization policy. Staff need to demonstrate that they've been immunized or have a valid medical reason that they cannot get immunized. Otherwise, they also need to participate in an education module to really make sure that they understand the benefits and the risks of being immunized and not being immunized. This is very similar to what we already have in place in schools, as you alluded to. So for a number of infectious diseases like measles, mumps, rubella, chickenpox, these are long-standing infectious diseases that we have really effective vaccines for. Here in Algoma, before the pandemic, we had really high rates of immunization for our school children. And again, there are active conversations right now to see whether or not COVID vaccination should be included as part of that legislation called Immunization of School Pupils Act. I think you might be on mute.
was. There's a couple of kids screaming in the background here, sorry. Dr. Castellani, anything you would add to that, or a different perspective? And then Dr. DellaVedova, if you have anything to add as well.
Yeah, no, I would say I agree that seems to be, the question, right? I mean, it's up in the air. We don't know. There are so many, things that are, relatively mandatory to vaccinate for. And there's a lot of processes that are currently in place. Why would COVID be treated any differently? I think because it's at the front of everyone's mind, we can openly talk about the contentious ethical and moral issues. But in truth, there are so many other vaccines that are mandatory in so many other walks of life. I don't see it being too much different. But again, only time will tell based on the discussions at the provincial, at the national, at the global scale. Because I mean, if countries X, Y, and Z are now mandating vaccination, and now you have to be vaccinated to travel or to do anything in the business world or whatnot, I mean, you can imagine that's going to influence a lot of what we do here. So I certainly encourage it. I think it's important. But again, there are so many issues that I'm also not aware of that I think will come into play and they have to discuss. So yeah, time will tell.
Dr. DellaVedova, anything to add?
Yeah, it's not just education either, but being able to visit someone at a nursing home, being able to go across the river, being able to get on a plane. There are all kinds of situations where different organizations, the province, the country can mandate vaccine status. I have mixed feelings about that. My hope is that the medical community, the public health community can do an effective job at giving the appropriate, thorough, accurate information to the general public so that enough people will get on board with vaccination that mandates will not be necessary. So I am optimistic that we can get there.
Very good. Optimism is always a good thing these days. I'd like to invite one of the students that's participating tonight to now speak. We have Sebastian on our call tonight. I believe he's a 12-year-old who recently was vaccinated. Sebastian, I'm wondering if you can just tell us about your experience getting the COVID-19 vaccine.
It was a pretty easy process. I just went to the GFL Memorial Gardens and then I signed in and went and got my vaccine.
Did it hurt?
No.
And how did you feel after?
I felt good.
That's fantastic. And you should be really proud of yourself because you're helping to protect your family and your community, and that's really great. So how do you feel now that you're vaccinated?
I feel good and I'm like much more relieved so that I'm safer to not catch the coronavirus.
That's fantastic. Well, I hope that you have a great rest of the school year, and that in September you can meet all of your friends back in class for a normal year. Thank you so much, Sebastian, for being here. That's really great. We have another student who's also going to share their experience, Daniella. So Daniella, can you tell us about, I think you were vaccinated. Can you tell us about your experience?
Yeah, I was vaccinated and I just went to the GFL just like Sebastian did. And like he said, it was a really easy process going through, like everyone was so very good at directing everybody and they did a great job that way. It was a quick process. I went in, got my needle. It didn't hurt. My arm was sore for about a day or two after, but that's to be expected with like any type of vaccine that you get. I've had that with past vaccinations. My arm has been sore, so it was to be expected. And I just felt like a little bit tired the next day, but it went away and I feel great now.
That's great. You're in grade 11, is that right?
Yeah.
What are some of your friends saying about the vaccine? Or is everyone getting vaccinated, or are some people waiting to see? Well, what's the conversation like in the teenage set?
It's a bit of both, to be honest. I do have a lot of friends that recently got vaccinated over the last weekend, and most of them are. I do have a few friends who are like on the fence about it. They're like, I don't know, and they have their own reasons for it. But in the end, they're thinking about getting it because if it's going to be the only way you get to travel or the only way you're going to be able to participate in certain things, they're like, I might as well do it now instead of having to wait to get it.
That's great. And you can sort of be like a youth ambassador, just encouraging everybody. And that's why it's great to see, you know, you and Sebastian here tonight talking about your experiences. So that's really great to hear. So thank you so much for joining us and sharing your experience, because we know research shows that actual real people talking about their experience getting vaccinated has much more of an impact than you know, reading about it in a newspaper, for instance. Not to knock my own profession, but so thank you guys so much. I really appreciate it. I'll turn things back on our doctor panel. One thing I was hoping that we could talk a little bit about was the under 12 set. So we're focusing obviously on 12 to 17 because they're eligible to get vaccinated right now. Dr. DellaVedova, I'll throw this to you, and then whoever else in the group wants to participate. But what do you think is going to happen with the under 12 set? Because obviously there's, you know, lots of families where they all have kids that are over 12 and under 12, and then people like myself and others who have just, you know, young kids and they don't know what's going to happen later this year, right? So I know that we're waiting for test results or study results to come in. And so I'm not asking you to predict what those might say, but what do you anticipate could happen, or what do you hope to see with kids under the age of 12?
I hope to see within the next weeks to months is that the leading vaccine manufacturers are going to submit some favorable safety and efficacy data to Health Canada to approve the vaccines for younger age groups. As I said, you know, the good news is that while, you know, we have not really been seeing a significant degree of direct impact from COVID, they certainly have borne quite a bit of the burden of the pandemic overall. So I'm hoping that they'll be eligible to participate in the vaccine campaign. If not, then it's still very important for cohabitants, so adults and older kids living in the households, to get themselves vaccinated. And until we can, if and when we get to a point where there is herd immunity, we still have really effective tools to stop virus transmission. So things like masks and hand washing and distancing and all of those things are still really good tools. Just because the vaccine came along and happens to be an excellent tool, it's still really important to follow those public health guidelines. So what I'm hoping for, what I'm expecting is that the age of eligibility for vaccines will continue to get lower and lower. And then we'll reach a point where we can stop COVID in its tracks altogether.
Dr. Liu, what's your perspective on that same issue as well? Like, I mean, we know it's going to take getting that group vaccinated to really end this thing, but yeah, what do you foresee? Because I know there's a lot of, you know, worry and anticipation in the community about that.
Yeah, so I share Dr. DellaVedova's optimism on this front. I think, you know, we are at such an incredible space and time right now. If you think about, you know, COVID-19 having surfaced not that long ago, the end of 2019, all of 2020, we were thinking, you know, when would the vaccines be available? And all of a sudden they were less than a year after the identification of the virus. So the amount of scientific work and the pace of it has been tremendous. There's lots of, you know, public health colleagues who are sitting on those review tables, looking at the data as soon as it comes out, and being part of those panels that review and make recommendations on vaccine use. And what we're hearing is that, yeah, the work is underway as we speak for the age group of kids 2 to 12. And I think that, you know, if we continue to see the progress that we have seen with our scientists and our researchers doing this work, there's really good reason to hope that that younger age group will eventually get immunized as well.
Dr. Castellani, do you have anything to add to that?
No, I echo my colleagues' sentiments for sure. I think, you know, just the studies will tell us what we can or can't do. Although I suspect even if the studies are equivocal or negative, probably we'll see more studies to try and push the envelope, or maybe some newer vaccines to consider, because it is an important piece. And if it's true, which I think there's good rationale, there's good science to suspect that we will see some seasonality and potentially we will see this virus being with us for a long time. I think it's important. I think every age group is important, to just like influenza, and it will follow a similar trend. And so yeah, I'm optimistic. I'm hoping, and I don't see any true reason other than maybe something unexpected, but I really don't see any reason we won't see the same success as the other vaccine studies. So fingers crossed.
You mentioned something interesting, and I know you touched on this a little bit already, but I wanted to get to this point, and that is about, COVID being around forever. So are we going to start basically needing a booster every year like we do with the flu? Or, how, I mean, again, hard to predict the future, but if this is to stay with us forever, what is that going to maybe look like? Dr. Castellani, I'll get you to start off there, and also, yeah, this idea of how long the protection from the vaccine will last, which I know you sort of touched on already.
Yeah, I mean, first that we don't know. I think that's the first thing we have to say, right? I mean, we don't really know where things are going to go, but I think there's some really smart people that have done a lot of good work before this with SARS and MERS, which are similar types of coronaviruses. We already have coronaviruses that circulate every year in the population. In fact, that caused a lot of confusion early in the pandemic when we had a few of those. But we see these viruses circulating, and so what's the likelihood that this one that we can't get, we would hope to get everyone vaccinated, but we probably won't get everyone vaccinated for many reasons. What's the likelihood it'll just go away on its own with the degree of infectivity that there is and the type of spread? I think it's extremely unlikely, especially given the way we travel and the way we function as a society. So I think it's with us. There's a bit of debate on that, but I think for the most part, consensus is it'll be with us. What does that look like? I mean, most times these types of viruses, they're seasonal. They happen more so in the winter, or in other parts of the world that don't really get the winter. They happen, for example, in places like India in monsoon season, right, where people are indoors, or in some parts of the world where it's really hot out, they'll be indoors more, so they might have it more spread when it's really hot out. But we'll see some seasonality to it. And how long this vaccine will work, whether or not we'll need vaccines year in, year out, or a change to those vaccines, time will tell. We'll have to see what the studies show. Pfizer and Moderna are watching closely, I suspect, there's a lot of academic or universities out there that are doing the same types of studies. They'll say, we'll have to look at these people that are vaccinated, and then we'll keep following them to see how long those antibodies are around, and then watching the regular population, as we're doing in Ontario right now, to see how well the vaccines work in the long run after the vaccine was given. So time will tell. I suspect seasonality, and I suspect we may need some extra doses in the future, but when, I don't know.
Dr. Liu, what would you say about that as well?
I agree. I think there's a lot of uncertainty right now, certainly with the mRNA vaccines. That technology lends itself really well to the creation of boosters, especially, when we know there are new variants that are evolving in many parts of the world. It's a fairly straightforward matter to be able to, sequence the new strain and then to just pop it into the next booster. It's a little bit more complicated than that, but essentially, the technology is really able to keep up if that were necessary. So I think, that is certainly a hopeful thing. Again, how often, how long, and is it going to be like flu once a year? Time will tell, and we're still really looking at the data and having the scientists and researchers study it carefully so that we make sure that our response to the virus keeps pace with the virus as it changes.
Thanks for that. And Dr. DellaVedova, anything to add on that?
I will defer those speculations to my expert colleagues in infectious disease and public health, but as a pediatrician who deals with the downstream effects of all of these infectious diseases, we are all very excited. So mRNA vaccine technology, while it's been decades in the making, really got sped up, and COVID was obviously the top of the pile to deal with. But once it's not at the top of the pile, we've got lots of targets for you guys to work on. So There are other viruses that have been very difficult to vaccinate against, as you can imagine, HIV, RSV, improved influenza vaccines. And this technology opens a lot of very exciting doors. So it's a very exciting time to be in medicine. Much of pediatrics is infectious disease. And so we're really looking forward to the next 5-10 years to see what this technology can do.
That's a great point to raise, and it's amazing what has been done in this short period of time. I mean, I still have a hard time believing that so many of us have already been vaccinated. I remember a year ago we were talking about maybe around this time this year, we'd have an approved vaccine. So it's just wonderful. For our next question, I'm going to turn things over to Elyce. Elyce is a grade 11 student at White Pines. She's getting vaccinated this week, and she has a question. So Elyce, please take it away.
Hi, thank you. I was just wondering, what will school look like in September? Because I'm going into my last year of high school, and I would love for things to be as normal as possible, and especially if extracurricular activities can open up again, because I love playing sports at school, and I was just wondering what it would look like in September.
Thanks, Elyce. Happy to start off on that one. And as always, I think everyone is asking us to consult our crystal balls. I can certainly say that, what happens in September depends a lot on what happens right now. So, the more people that we get of our school community immunized, first dose in June, second dose a couple weeks before school starts in August, the better position we'll be in to be able to loosen some restrictions. As you know, the province has put out a roadmap to reopen, set at 21-day intervals, and it's set at different milestones of how much of the population is immunized, because the more protection that we have from vaccines, the less protection we need from those public health measures of distancing, of masking. Those public health measures we know have worked. They've worked all through the pandemic before we were able to get the vaccines, but we're tired of it, right? The vaccines have such good protection. And if we manage to achieve those high rates, 75%, 90% of people getting immunized, then what other jurisdictions like the UK and Israel have shown is that, yeah, absolutely, they are able to transition back to things that we enjoy so much, like those soccer, outdoor activities, and also, small indoor gatherings are starting to be much more common in those jurisdictions as well. So I think there's a lot to be hopeful for, but it's not a guarantee. It depends on a lot of us rolling up our sleeves and getting immunized.
Does anyone else want to jump in there?
I mean, the only thing to say is I echo Jen, Dr. Luce's thoughts on that for sure. I mean, that it's up to us. I suspect, fingers crossed, we're going to the summer. If we all get, or a lot of us get vaccinated and we all keep distanced and, gatherings are, relatively small and outdoors, I think it's possible to get to some normalcy in the fall. I think there's a lot of work being done, improvements in ventilation and class sizing hopefully will also be on the docket. I mean, I can't speak for the education folks, but that would be ideal. So hopefully, fingers crossed. And Elyce, room raiders, great wall in the back there. Must give you props. Looks great.
The fact that makes sense to everybody is just a testament to how far we've come in this pandemic. Dr. DellaVedova, would you add anything to that just from your perspective as a pediatrician?
I'm hopeful that we can get back to routine and normalcy in September. It all depends on how things go over the summertime. It would also be expected for the first month or two of the school year to similarly be a big experiment like we're all in, and then to carefully look at transmission rates in schools and then make further decisions based on that. But it looks like with the gradual repealing of public health measures that things are still progressing in a direction that's positive. We've got some examples to look at, including in Europe and our neighbors to the south as well. So if all of the markers are still looking green, then I think we can be optimistic that the 2021-2022 school year is going to look a lot different than the past one.
Yeah, let's hope so. Elyce, I hope that helps answer your question, and good luck this week getting your vaccine. Thank you so much for participating tonight. Really important to hear those voices from the community. We have a couple minutes minutes left, and you know, we could go on all night, but I'll try and get as many questions through as I can. And this is sort of near and dear to my heart, which is, you know, misinformation being spread online and by anti-vaxxers and others. That seems to really, you know, it's everywhere now, right? Like it's really hit the mainstream. One of the issues that was brought up by a community member was the issue around consent involving young people. So Dr. Liu, I might just ask you to chime in here first and just maybe explain how vaccination consent does work for young adults and of particular ages. And then maybe just generally speak a little bit more about how troubling misinformation is right now and any possible strategies to combat it.
For sure. So here we always get consent from the person who is receiving the vaccine. And it doesn't matter how old they are, because in Ontario, there is actually no age of consent. As long as that person is able to understand the risks and benefits of getting immunized, and as well as the risks and benefits of not getting immunized, they are considered capable of making that decision. And so that includes our 12 to 17-year-olds. So certainly, you know, we never give any kind of medical intervention, be it a vaccine or a drug, unless there's not just consent, but informed consent. So at every immunizing station, all of our healthcare providers are able to provide that information to the person getting immunized, so that they're not just saying yes, they know full well the risks and benefits of getting immunized. So to the point about misinformation, certainly it is very troubling, and you know, this is the point where misinformation is not just, you know, something to be brushed off. In the context of a global pandemic, it can be so harmful. It can actually create a lot of damage, particularly in groups and communities where it's driving people to do behaviors that are not preventive, and also to decline the immunization. And what research has shown is that, you know, we don't want to brush off misinformation or dismiss it. We want to actually talk to folks to really understand where their positions are coming from, and again, have those honest conversations to really get at any fears, any questions, and provide them with credible information. As I think we've illustrated through a lot of your questions and a lot of our responses, there's a lot of uncertainty right now. And so, you know, what we try best to do is not to, you know, provide you with answers when there aren't any. We want to acknowledge uncertainty and say, here's what we know, here's what we don't know. And for those unknowns, here's what work is being done right now to try and look into the issue. And here are the risks, and here are the benefits. So I think it's having that really a close and clear conversation, and evidence shows that it works best when it's someone they know and trust. So peers, family and friends, your own family doctor or pediatrician, these are the folks that are most instrumental in boosting vaccine confidence.
That's great. Dr. Castellani, would you add anything to that?
No, I would just say that last point is so important. You know, anyone listening who's, you know, a big advocate for vaccines, I'd encourage you to go out there and keep advocating. I think it's the efforts and work that everyone has done that I've actually seen a lot of my patients after I initially had some conversations, you know, many months ago, and I'd see them after, you know, and they seemed reluctant to get the vaccine, and, you know, I see them now and it was a non-decision. They went and got the vaccine, and I know it wasn't our conversation in the few minutes that we were together. I know it's because the collective effort of so many people, including actually the media and, you know, friends and family and everyone, that have led to, you know, adequate information or good information being pushed out. Certainly there's always misinformation, but I think as long as we're all out there pushing the right information and directing people in the right way, I think we'll see a positive influence for sure.
And Dr. DellaVedova, would you add anything to that?
Yeah, I agree with my colleagues. It's up to us to earn the trust of our patients and the population that we work in. And that means giving the best possible information and taking the time to do it. So I'm hoping that this session is a part of that overall strategy. What I tell parents in my practice is, We grew up down the street from each other. I'm from here. I have no interest other than to help you and your kids be well. I'm not getting paid by the vaccine companies based on, over a decade now of experience in the pediatric profession. I've looked at all the information. This is my opinion. I'm happy to share that with you. I'll give you all the information that you need to make the best possible decision for yourself.
That's fantastic. And the one thing I have seen in the last couple of months is that people are really now saying, yeah, it's been this collective effort, these conversations that have helped convince them, which is something nice to see, because we all feared that so many people would resist taking the vaccine. So hopefully that keeps up and we get as high levels as we can. We have just a couple of minutes left. So one topic that we didn't address yet, but I'll talk a little bit about, then we can open it up as well. And that is the impact on young people. And we just, I feel like we often gloss over it sort of in the media and things like that, canceled events, kids who are staying home, not being able to socialize in person. And you mentioned some of the harms that you're seeing. So maybe I was just hoping you could talk just a little bit about that and what maybe we can or should be doing to try and repair some of this damage in the months and years to come.
Yeah, that's a great question. Carly, there's really two pandemics going on. One of them is the COVID pandemic, and the other one is the increase in mental health problems that have come about secondary to the pandemic. And no one is saying that all of these restrictions have been unnecessary. So saving lives is job number one. But those of us who work with kids, whether we're doctors or counselors, teachers, daycare workers, anybody, could easily tell you that it's been a very, very challenging year for kids, both young and adolescents, being restricted from seeing your friends, which is a big part of life as a teenager, being restricted from going to school, having interruptions in your learning, not being able to access some of the healthcare that you used to be accessed, everything going virtual. It's been very, very disruptive. We've got kids who are safer if they're at school than they are, if they're at home with their parents. We've got teenagers who are feeling a total lack of control over their circumstances, and so they turn to eating disorders. We've had a lot of kids, increased numbers of admissions for depression, anxiety, suicide attempts. It's been very, very difficult. And it's been difficult for those of us who care for kids to reach them when visits are canceled or going virtual. It's been just generally very difficult. So what I'm hoping for and looking forward to is a world where we can gradually get back to normalcy, and we can start repairing some of the damage of that pandemic that's been sort of behind the scenes and going on all along.
Mm-hmm. Dr. Liu, on a local level, how challenging will this be to try and do some of this work? Anything that you guys are already thinking about there?
Absolutely. I share a lot of concerns that Dr. DellaVedova has brought up. I think what we're also seeing is that, there has always been a gap in terms of health outcomes. Those who are particularly well off, privileged, they are first in line to get their vaccine. They are the first to get back to normal. What we also know is that, it will become increasingly more challenging for us to do our outreach and get at those youth and families who normally find it challenging on a regular basis to attend a normal appointment, never mind, book into an appointment and get their vaccine that way. So absolutely, I think that we need to put a lot more resources into outreach to make sure that it's not just the folks who are eager and first in line at a high-speed internet who are immunized. We see in a lot of other health units that plateau happening where they've already gotten all the eager people and now, at 60-70% of adults, they now need to do a lot more outreach, pop-up clinics, bringing the vaccine and showing up into neighborhoods and where people are at to make sure that they're not left behind. So we're actively working on those strategies as well.
Thank you for that. That's great, and we'll hopefully see very good things in the months and years to come. Dr. Castellani, we're out of time, but I just wanted to give you the last word, maybe on that point or any other, just as we are hopefully in the home stretch of COVID-19, some things that you're thinking about and where we're headed next.
Yeah, I mean, I think you hit the nail on the head. We're in the home stretch. But we've also said that there are a lot of pieces that are moved. There are a lot of moving parts, and it's up to the collective us to move us forward and to get towards the finish line. There may be seasonality, sure. There may be future vaccines in our midst, but we can get closer to normal, and that's up to all of us to get vaccinated and all of us to advocate for our friends and families to get vaccinated and to continue following the public health guidance, because without both of them together, we won't get out of this pandemic. And so, I'm very hopeful. I'm wearing the hat and it's white, and it's one of those sort of signs and symbolism things that my wife showed me. And I think I just can't wait to get back to some normalcy. And I really hope everyone else feels that same buzz. It's not over. It's going to be a bumpy landing. We all know this. And so brace yourself. But I'm looking forward to the Roaring 20s. I really am.
And I love that, the plane analogy, because we can all sort of almost taste it. We're almost, getting on board and heading off to our favorite destination. And yeah, it's been a bumpy ride so far, to say the least, but that's a good way of putting it. It's going to still be bumpy to come. And, as I'm wrapping things up here, I would just note that, yeah, it's not over. And so even though, we're hearing, the stay-at-home order is over, we're still really not allowed to do a whole lot. But it's hopefully going to all be worth it in the end. And, if you're going to meet up with people, because it is happening, just please be safe. Please do it outside. I personally know someone who probably avoided getting a case of COVID by choosing to meet outside rather than in, with a friend who tested positive a few days later. So it's definitely worth it. And I just wanted to thank everyone for being here today, because this was a fantastic discussion, and it's a great opportunity to get everyone together. So Dr. Lou, Dr. Castellani, Dr. DellaVedova, as well as Sebastian, Daniella, and Elyce, and Anita, for even taking time out from her kid's birthday to be here. So just thanks, everyone. This video is going to be available on the Algoma Public Health website, so please share it with your friends, share it with your family. A lot of questions were answered just even in the first 15 minutes. Castellani. So once again, thank you all for being here, and stay safe and have a great night. Okay, thank you all. Take care.
Thank you.
I'm sure we'll be in touch soon.
For sure.
Bye.